Recording. Okay, so we are recording. This is the Family First update that our statewide advisory council has hosted for us. So we appreciate Sarah Lockery and Mike Halpin for your efforts. Let me go ahead and share my screen. We have with us my co-chair, our co-chair in the Family First work, Joshanda Gurrier. And I think, Joshanda, we have been at this work now beginning, whoops, let me back up. We have been at this work now beginning, I think, November of 2019. And took a pause due to the COVID pandemic, but then had a relaunch back in September, and here we are. So, Joshanda, would you like to say anything to the group as we commence?
Just want to say hello to everyone and thank you for having Ken and I join you for today's discussion on Family First. We welcome your participation. I know we only have roughly 50 minutes left in your scheduled time, but the point of this is to be able to address any questions that you all may have. So feel free to use the chat or raise your hand and we will respond accordingly. And if for some reason we run out of time, we're happy for you to use the Family First website to continue to convey that information, which we will provide you that contact email address on the very last slide.
Great. So to really ground everybody and start with our overview today, we thought it was a good idea to go back and say, what exactly is the Family First Prevention and Services Act? So what this is the Family First Prevention Services Act puts focus on prevention in child welfare with the goal to lead more families remaining permanently together. The whole point, you throw out money, you throw out plans, if you throw out everything else you've heard, this right now is all geared and all efforts are geared to ensure that families have what they need so they can remain permanently together in a safe manner. What we know is that jurisdictions across the country are required to develop a statewide prevention plan, which includes identifying those families most likely in need of supports. A couple key points here right off in the beginning is that the plan that we are all working on is the state of Connecticut's plan to ensure children are safe and are healthy and thrive. Yes, the Department of Children and Families is leading this work, given that we are the agency where 4E funding at some point will come back to. But our work to date has always been viewed as statewide, inclusive of our partners and sister state agencies, geared towards when this plan is signed off by the governor's office and submitted, it is the state's prevention plan for children. The term supports is there deliberately. We've learned so much about this process and the interpretation of the federal legislation and from all of you that have joined us on this journey. Do we look at families in need of support, or are we looking at families and believe they need to be surveilled or subject to surveillance by a child protective service agency? I think that's an important distinction. Right now, across the state, the department tends to be the first call when a family is in need. We want to make our department the last call. That doesn't mean that we don't want to intervene and assist families, but we're the Child Protective Services agency, and we want to develop a system so families have more supports in a timely manner in their local communities earlier on in the process. I think this work has also taught us a lot about how we view families and communities. Do we view particular communities as broken and therefore the children and families there need to be rescued or saved? Or do we look at particular communities and feel that given the circumstances that exist, they're quote unquote bent and they need support? And that's the mindset that we have. Connected to that is a point that we are going to develop community pathways for families so they can access family-centered, community-based resources. We're going to talk at the end of our presentation today about our listening sessions that were entitled Parents as Experts. And we brought in over 40 families to help us understand what their experiences have been like when they've accessed or attempted to access resources in the communities. So as we build out specific places where families can call, what is it that those organizations need to look like? Who are the people that should both man the phones and do the outreach and interact with our families? What the Family First Prevention Act also includes is that there are incentives now for states to utilize and implement evidence-based services for our families that address mental health, substance use treatment, and in-home parenting skills training. What that means is evidence-based services are those programs that in fact are ones that are proven, they've gone through trials, they are the most effective for the children and families that we serve. So now, as part of our prevention plan, we will be including specific evidence-based services for our families that connect to what we call a candidacy group that Shoshana is going to talk about in a little bit. And when those services are implemented, there is going to be some degree of 4E dollars, 4E reimbursement that will come to the state. The last two components of our Family First plan are the Kinship Navigator program, that we are bringing together those services and supports in our communities where relatives who are raising children can receive timely referral, information, and follow-up services. The term relative was used deliberately, not just grandparents. We know throughout our systems that we have thousands of children across Connecticut being raised by relatives. And what does that mean? That means there needs to be a coordinated approach to support them. And lastly, you're going to hear a lot about quality residential treatment programs, a QRTP. What is that? This act requires higher standards for treatment of youth placed into congregate care settings. We want to look at youth to be able to remain in their families. If they cannot remain in their families, we want them to be able to be placed with a kinship provider. They can't remain in a family structure due to an identified treatment need or treatment needs, then we want that setting where they are placed temporarily to be high standards to ensure that they receive comprehensive treatment to be able to return back to the community as quickly as possible.
And so language matters. You just heard Ken step us through a system. Family First really is a tool that we are leveraging in the broader system of Connecticut's overarching prevention plan. And so the last year and a half now, as Ken indicated, we've been at this since November of 2019. The whole point was to utilize the federal legislation of Family First that allows us to be more intentional of serving families in their community more upstream than involved with the department. We as a state decided to really use that as one anchor, if you will, in looking at how we serve all families. And so when you hear the updates and the preceding slides that step us through each of the work groups and the work that we've been engaging in, what you will hear is there were some very coordinated things that we needed to do specific to the federal legislation, Family First, but we decided to go bigger and broader than that to make sure that we were more inclusive, to think about meeting families where they were, irrespective of whether or not they met the conditions of Family First, which in effect is just a financing tool to reimburse for very specific mental health, in-home parenting, and substance misuse disorder treatment evidence-based services programs. So Ken, if we could, we'll begin to walk them through the specifics of our values and system infrastructure, and then step through the rest of the work for the work group. Unmute yourself, Ken.
Yeah.
How's that? Better? All right. Let's see, can you still see the slideshow? There we go. Whoop, back up. There, is that better? Okay, so what this is really about, this is about values. This is about what we believe children and families need and deserve in our communities. This is about our systems transformation. We are not going to continue to do business as usual. And I think we've already begun to make great strides in understanding what we envision our system could be and should be for the children and families that we serve. It's also about collaboration and sustained partnerships. So at the beginning of our presentation, we talked about bringing together community providers starting in November of 2019. We paused. We had a relaunch in September of 2020. We do not envision this Family First work as an initiative. This is the work. And moving forward, we are continuing to have work groups. We're going to continue to bring you to the table. We're going to continue to ask for your input. So we have those sustained partnerships that we've already built upon moving forward in the future. And lastly, when we talk about resources, this is an opportunity now for the state of Connecticut to realign resources to match our values. Yes, there's components of Family First that entail money and reimbursement, but we are using this opportunity to say, first of all, what matters, and now let's align our resources to demonstrate what it is that matters. When we first wrote this slide, we believed that we had over 250 partners that came to the table with us. We've received great consultation from Chapin Hall, a policy and research center based at the University of Chicago. They have been our partners in this journey all along the way. We have collaborated with sister state agencies. I think we've had at least 7 different state agency commissioners that have participated in our work along with numerous of their staff. We have contracted providers, but also community partners, those individuals who don't receive any funding from the department. As we've mentioned, we've had parents with lived experiences and youth, and we're thrilled to tell you that we did a recount last week of all the unique individuals that have come with us on this journey. That number 250 is now actually over 350 different people across the state have come to join our work groups. And that doesn't even include the 44 families that we spoke with last Tuesday, Wednesday, and Thursday night who added their input. So we are really proud of the transparency, the collaboration, and the sustained partnerships that we have had so far.
And so when you think about how we've structured this work, Ken has talked to you about the partners, but when we look at the oversight of the recommendations that have been put forth, we have what is called a governance committee. Our governance committee is the overarching body of appointees that hears what the work groups present as what should be included in our plans, and they then make recommendations to the commissioner, who will make the final decisions with regards to what should be in Connecticut's plan for prevention going forward. And so to date, some of the things that the governance committee has already approved is the candidacy definition, which I will be stepping you through momentarily, recommendations from our kinship and foster care work group, which speaks to their core values and the decision to build a practice model and a kinship navigator program. Our programs and service array group has really done a deep dive into all of the services that are currently being offered in the state of Connecticut, as well as those services that have been approved on the Family First Clearinghouse, which is a clearinghouse of all of the evidence-based services eligible for reimbursement under Family First. Our infrastructure, practice, and permanency group has made a recommendation as to the system going forward and how it should look different for families to access the services that are being recommended by the programs and services array group. And then our intensive treatment 24/7 quality residential treatment programs, they've made a recommendation as to aftercare and various components of how our kids who need that level of care should be served based on the criteria and components that's in the federal legislation. So we're going to step right into the candidacy definition. This was approved by a joint group, as all of our groups were inside-outside partnerships. So we had community stakeholders at the table, as well as DCF staff, and a few of our parents, representatives of this SAC council was present through the planning of this. And what we decided as a state is that we really wanted to be inclusive in Connecticut. And so the feds told us with the Family First legislation, they said, state of Connecticut, tell us what your definition is. How do you define those families who are at risk for entry into foster care? So how do you identify them in a very upstream manner so that they don't have to be at the doors of DCF? How do we serve our families in the community in a way that allows them to be empowered to get the services that they need? And so in those discussions with those work groups, what they decided is we want to include in our candidacy definition a few of our currently engaged DCF families. So if you have received a call, if you had an accepted report at the care line, that will be included in our candidacy definition, as well as any family who raised their hand requesting voluntary services. The federal legislation specifically speaks to youth who are in foster care, who are pregnant and or parenting. So those were included in our definition. Siblings of children in foster care. So if you have a situation where maybe one child of a family has been removed and others remain home, we want to make sure that we can make that family eligible for services for those children who remain home so that we can stabilize them in a way such that they might not need to come into care. And then the last DCF-centric population is youth exiting to permanency or youth exiting out of home care. So even if you had a previous interaction with the department and now things are well in your home, you have your kid back, we still want you to be able to get these preventative services to always support or stabilize. Inclusion into this definition is in no way intended to suggest that you are going to abuse, abandon, or neglect your kid. What it is saying is, because we want to be inclusive, we intentionally made the definition broad so that anyone who potentially need this service could come into the system to say, I would like to be eligible based on this criteria because the feds require us to have one. And now we're going to do a needs assessment to see if we can map you to an evidence-based approved service to be able to stabilize your family and your youth in the home. Ken, if we could step to the next section of our definition. So the last slide talked about those families that are usually known to us. The part of the candidacy definition that we are most excited about is this particular community pathway slide. We took the moment to really reflect to say, where are those families showing up in the system that we might not already know of? Where do they present? Where are the referring sources? Is it pediatricians? Is it hospitals? Is it the school system? Is it their local grassroots organizations or their faith-based communities? How do we make sure that we allow those families to also raise their hand to say that we need support? And so in our community pathways group, we specifically called out those children who are chronically absent from preschool or truant from school. Those parents can say, I need help. Any children who are children of parents who have been incarcerated, we recognize that the caregivers who are in the community caring for those youth when their parents are incarcerated for whatever period of time, they oftentimes need support to stabilize those placements when they're trying to make sure that they're wrapping those youth with what they need. And so we wanted to be able to open up the door for those caregivers to also get services for youth who have been entrusted in their care. Any youth who we know may be victims of human trafficking or suspected to be human trafficked, those youth are eligible for services, as well as anyone who is unstably housed or homeless. We were intentional in saying unstably housed because, again, our goal was to be inclusive. We did not want to narrow by some arbitrary definition of HUD or McKenty-Vento. It is if a family says that they are unstably housed for whatever reason that circumstance is, we want them to be able to get the mental health services that they may need for their youth, as well as any child that's in our juvenile justice system and trying to figure out how far upstream do we go? Is it at arrest? Is it at diversion? Is it because the child has been referred to a juvenile review board? We really struggled with this one because, again, we don't want them to go deeper into the JJ system, and we don't want them to come into the DCF system. So where do we identify them early enough in their interactions with that type of behavior so that we can hopefully change their trajectory, was the goal to include them here. And lastly, we recognize that sometimes we have parents or caregivers who themselves may have mental health challenges, or they may have a disability of sort, or a parent could be dealing with a youth that is struggling with substance misuse disorder or may have some mental health needs. And if any of those things are impacting the parent's ability to parent, we definitely want to open the door to them. That is not to say that we're making an assumption that anyone with a disability automatically is at risk for entry. That's not what we're saying. Right. We're just simply saying, if you know that you have a need, this is just another opportunity for you to get the support to be able to move deeper or into our prevention services, as opposed to being on the safety side of the house with the DCF supports that you previously may have been familiar with. And the last part of our community pathways are our infants born substance exposed. And so some of you may be familiar with our CAPTA legislation that basically says that if a child is known, or shall I say a fetus is known to have been exposed in utero to substances, someone can basically do an anonymous report for CAPTA to make sure that we are providing what the family needs long before it is a issue or concern. It does not necessarily translate that that baby needs to come into care. We're just saying, if we know that there's some additional support, let's use that CAPTA definition to support any infant that we are aware of that has been substantially exposed. So candidacy is the bridge of the who. These are all of the opportunities for you to access our services. And from the candidacy definition, there were other work groups. Ken, if you could move us forward, please, sir.
Yeah. And if we could, if for those individuals on the line, if you could please mute if you're not talking. We do have a little feedback, and I think it sounds like somebody's shuffling some papers around. So if you could do that, that would be helpful. As far as our kinship and foster care work group, this group met early on in a very intense way and included, I think, over 60 members. Their work now has been completed as far as the work group recommendations. And now moving forward, they are developing and implementing a caregiver practice model. So what does that mean? This aligns our vision and values with policy and practice by really guiding the work of not just the department, but our contracted providers, foster parents, into what we want our caregivers to do, how to conduct themselves, and what the structure should be for our caregivers across the state. Underneath that is also to develop a Connecticut model for kinship navigation. So in the first slide, when we talked about an overview of the Family First principles and key points, one was to have a coordinated way to ensure relatives who are caring for children receive supports. The kinship navigation model brings that work together. And if that model is done correctly, we may be able to receive federal reimbursement for the services that that kinship navigation service entails and other related matters. So again, with kinship and foster care, it's now organizing the work group's recommendations to ensure we actually have a model for the way our caregivers are going to practice. And then we actually have a model that defines how we help and support specifically kin who are involved not just in the DCF system, but in any system across the state, if in fact they are caring for children. Our intensive treatment 24/7 quality residential treatment program, well, what is that? So we know now that in Connecticut, approximately 6% of our children who must be placed out of home are in congregate settings. That's a very, very low number of youth. That's a significant number, and we are certainly very proud of the work that we've been able to do over the past decade to reduce the number of children in congregate care. But we always know we're going to need congregate care as a treatment setting for youth in a diverse number of ways. What the Family First Prevention Act says is in order for states to receive federal funding for youth placed into a congregate care facility, that facility must meet these qualified residential treatment program guidelines. But let me stop right there. This isn't about money. I think when you look at these guidelines, we would all agree that a child who's being placed into a facility that has these criteria is going to receive better care and better treatment, which hopefully we will lead to a quicker discharge back into the community. So what are Qrtp requirements? That first of all, children will be assessed to determine if that level of care is the right level of care, and that assessment's going to be done by an independent entity. We want our treatment programs to use a trauma-informed treatment model. We must ensure that there's nursing and clinical staff accessible 24 hours a day, 7 days a week. We also know that part of the federal Qrtp standards ensures that or intends to have each of our facilities licensed by the department, but also accredited by certain national organizations or a national organization. Joshanda touched on this point earlier. We also want to have the facilities provide 6 months of aftercare for the youth that are discharged from their programs. There's a real connection there. We know that youth may need an elevated period of time for treatment, but when then they go back into the community, who better than to monitor and oversee parts of their care and transition than the people that have provided them that intensive treatment for a period of time. We also want to ensure that families are engaged in part of that decision-making process. And as part of the Qrtp standards, there's increased court oversight over placement where a hearing will actually be held, which leads to a judicial determination that the place where the child has been placed on a temporary setting, on a temporary basis, is actually meeting their needs, and they require that intensive treatment in that setting. So again, these are the criteria set forth in the Federal Family First Act. We are in the process now of implementing them and working with our contracted providers to ensure their programs meet these standards. There is legislation pending to establish them in state statute. Yes, we will, if the judicial determination says the child is appropriate for that placement and that placement setting is meeting their clinical needs, that is going to lead to federal reimbursement. But again, I think we want to emphasize, we believe these standards are the best for children, even regardless of whether the federal reimbursement in fact would come.
Thank you, Ken. So our infrastructure, practice, and policy work group was tasked with trying to put it all together. And so you've heard us speak about the who by sharing our candidacy definition. We touched on Kinship and Kinship Navigator and how we're going to serve families and relatives and kin differently. Ken just spoke about our Qrtps and what that does that mean for our families who have to integrate in that congregate setting temporarily to address their therapeutic or clinical intervention needs. But the infrastructure, practices, and policy group really wanted to step through what are some of the eligibility criteria that we need to put in place to comport to the requirements of Family First. And then what does that system look like? Resoundingly, what we heard from our work group members, as well as reinforced by what we've learned during our Parents as Experts community conversations last week, is that we really need to build a system that sits outside of DCF as we know it today. People spoke a lot about wanting more of a public-private partnership where there was an entity that families could feel safe in approaching to express that they have a particular need. It was very important to work group members that this be easily accessible for families, that we do this work in a very empathetic way. One of the things that came out of our parent conversations last week is parents would respect it more if a professional, quote unquote, would say that they don't know if they're asked an answer or they don't know how to do something, to acknowledge that, but be willing to say, but let me figure out the answer. There was a lot of conversation in making sure that while they really believed that standardization and easy access was important, equally as was important was this need to make sure that we don't lose the integrity of localized systems, that there are some unique pockets in Connecticut that they wanted a little bit of latitude to make sure that they're able to design a system that speaks locally to their needs while being connected to this larger umbrella of centralization and making sure that all families have access to all of the services in a way that is empowering to them, that is stigma-free, and that there are opportunities for people to show up in different ways that is not always necessary for them to present in person, but that maybe there's an online option, that there's a phone call option. We've all learned to kind of navigate in this virtual environment. And so all of those things had to become considerations when we think about the design of the system going forward. So while that will be our recommendation in this planning phase of the work, there is still quite a bit of work that needs to occur to actually put that new structure in place so that it is a real thing for families to be able to thrive and flourish.
So as Joshonda indicated, and we've spoken a couple times this morning, we had 3 parents as experts facilitated discussions last week. We wanted to draw more parents in because we felt their firsthand knowledge would be very informative as we develop our statewide plan of services. The groups were facilitated by a community partner and a consultant from Chapin Hall. Joshonda and I facilitated the Wednesday group, and the themes that are outlined here were discussed in each one of those meetings. What was it like getting access and the initial contact to services and support? How were your family's needs and priorities identified? What was the connection to services, and how did you benefit from the support, and what was that experience like? And in an overarching way, what would be the ideal experience be for families in Connecticut if you could design it? And just some very high-end concepts that came out and themes that came out from last week are right away, as Joshonda said, the service providers. And we say, this is feedback on DCF and the other supports in the community who touch families. One of the things that came across right away was that humility, that given the complex needs of a particular child or a family member, families appreciated when that support to them said, I don't know what to do here, I'll figure it out, or let's figure it out together, rather than having that family be pushed towards a service simply because a service was available and it may not necessarily have been a good match. Families were very clear that they wanted services to be trauma focused and informed. We had a number of parents with children who had specialized needs, a handful of families who actually adopted children, both from the department and privately, and had some very difficult scenarios that they talked to us about in regards to the supports that not only their child needed, but they needed. And there were limited places that they could go within the state. Families expressed wanting, service providers to join with them and be with them and not worry about checklists or questionnaires, just engage and assimilate into the family structure as best they could. We also talked a lot about mandated reporters, and is our mandated reporters in our community risk adverse, and is their first call to the department, or if we had a pathways and a community pathway entity developed, would mandated reporters be more apt to call for services when those are created? And I think lastly, a lot of what came out is the importance and the benefit of having individuals with lived experience talking with you as you are trying to access and embrace supports. A number of families talked amongst themselves that they knew each other on the call and benefited from knowing that if they were going to go to a PPT meeting for the child at school, they could connect to somebody who had similar experiences and talk that same language and really demystify where they were going. So we believe we received a lot of really good information. And again, we'll continue to take a look at all of the feedback that we received to best inform our system.
So our last two work groups are programs and service array and our fiscal and revenue enhancement. Programs and service array group has been working very diligently the last year to really dig in to understand what is Connecticut's current service continuum. What is working? What do we have? Where are they seen in the various pockets of the state? Is it sporadic? Is it abundant? What are some of the outcomes that we know about families? And then cross-referencing that information against what is on the federal Family First Evidence-Based Services clearinghouse. And so in them doing that inventory, if you will, of services and really looking at what we gave to them as our candidate population and attempting to map the availability of services to the population to see how do we fit those particular needs. What the programs and services array group ended up doing is lifting up what they referred to as our tier 1 services. So those things that we know are already federally approved. There were 8 of those that they handed off to our fiscal revenue enhancement work group, and then another 5 are tier 2 services, where they know that we are currently providing that service in Connecticut. While it might not be on the clearinghouse yet, it's definitely something that we want to keep our eye on to see if there's a recommendation for us to include it in our plan. So in them submitting those initial recommendations, they've run them through governance, as I've shared with you earlier. Our fiscal group is now taking a look to see of those services that could potentially map to our candidate population, how many of those are already covered through other programming? Are they currently Medicaid eligible? Do we currently see that it's in limited use? So maybe it won't serve as many people if we include it in the plan. And after doing that full analysis of what does it mean for us financially, they will then hand back to the programs and services array group a smaller subset of the services that were given to them to be able to make a final recommendation to our governance committee for inclusion of the plan. So let me be clear, because I know it has been confusion for some people where they've gotten a little nervous if they don't see a particular service that we know that we currently offer in the list of recommendations or doesn't end up being in the resulting plan. That does not mean that we are not going to provide that service in Connecticut anymore. It just simply means that that service won't be reimbursed by Family First. It just means that service will likely be provided by some other service if there's, some other funding source, if there's an identified need for families, for kids, for us to have a different justification to keep that in our service continuum. So know that this assessment piece has been very fluid. We really are trying to make sure that we are mapping to our candidate population so that we have a number of services that serves them best. The other thing that I kind of want to dispel is this notion of we have one shot to submit a plan. That too is not true. While this is our initial submission of the plan and we are doing our due diligence and looking at the data, making sure that we keep racial disparities at the forefront of thought, making sure that we're considering services that work best with our Black and brown children and families, all of those things have been intentional so that we get the best product for Connecticut. But if for some reason, once we start to implement things and we learn more, we get more input from families, we start to really look at outcomes through our continuous quality improvement programs, then there is an opportunity for us to make amendments to our plan to adjust, to further enhance it so that we serve our families differently and better. So know that this first iteration cut is just that. It's our initial plan submission. But as we step through our additional steps moving forward, we'll be able to tweak our services. So Ken, I think that that's a perfect segue into this slide that basically says that the first timeline is upon us. And so we were really shooting for April. It is likely starting to look more like May, and that's just because we want to make sure that we're making the right decisions, and we want to take the time to incorporate all the wonderful feedback that we received last week. But ideally, our first finish line is a finished, polished product for submission, not only to many of you all. We will have an open public comment period that allows folks to see it, and we want to hear your feedback. So we're going to do that. We, of course, have to have the plan approved by the governor's office as well. And then we would submit that to our partners at the Administration for Children and Families, which is the federal government, for them to sign off on our plan. So that is this first finish line that you will often hear us refer to, but that is not when the work ends. That just means that we can all celebrate and be very thankful for the blessing of having an approved plan, but then we jump right back into it to get into our phase 2 work. Our phase 2 work is implementation. That is where we're going to have to establish new work groups based on the rollout of all of the things that you all just heard us talk about with regards to the recommendations for Qrtp, the recommendations for infrastructure, practice, and permanency, which means we have to look at workforce, we have to look at training, we have to make sure that we have measurement strategies in place to ensure that we're delivering a quality product. We need to look at our data elements to make sure that this outside entity is able to gather the data elements that's required for the feds for us to then receive it and report it for reimbursement purposes. So there's a lot of work still ahead, and we want everyone still at the table. We will continue to be transparent. We'll continue to partner because without all of your voices, we can't ensure that we have the best product for the children and families of the state of Connecticut. So we'll stay queued in, and there's the way for you all to stay connected to this work. The Family First website, of course, has all of the documents we've ever created, all of our slide decks, our meeting minutes and notes, all of that is there. And so you just want to make sure that when you go to that that site, there are colored tiles by work group name. If you click the tiles, then behind them, you will actually see that work group specific information. And then Ken referenced the email address earlier where you can continue to email your comments, questions, or concerns to move us forward. So Ken, I see a hand from Miss Rose. And I'm going to pause to allow her to pose her question.
My cat is not working. I don't know why. But I would love to see how you guys strategically bring parents to the table. I heard you say a lot about how we talked about in the listening session, the one I was in, of how we want to see more of those past parents as coming and speaking with present parents. But also, I think, and I don't know if this is a policy change or how we do it, but I think it's important for the providers that we work with not to tell our children who need services that it's voluntary, because that's not working out. So I give you transparency, right? I call DCF on myself because mentally my kids are just like, 2 of my boys are just not there. Every service that was provided for them, let them know that it was voluntary services. So at that point, my child says, well, why are we talking? Because a kid doesn't think that they have an issue, right? So why are we letting them know that it's voluntary services? So I think that's a language that we need to fix. And I don't know if that's a policy thing or what it is. I also heard you talk about at what point do we say we don't want to see this kid come back and forth to us, right? If they be sent to JRB or if they're in front of the judge. Okay, so at what point do we go back and look at the past services that they had to make sure that we're not referring them to the same program or similar program that obviously didn't work if they came back?
Yeah, you bring up two really good points, Samaris, and we appreciate you jumping right in and asking us those questions. So I think the first one, as far as services, right? And I stopped actually sharing the screen, so we all should be back together now because the PowerPoint is ended. We can put up the website one more time before we end. You know, Samaris, I think you raised an interesting question. You know, services are voluntary, unless they're mandated by a court. And I think what I hear you say, though, is there's a messaging piece here that we want to ensure across our system, that we don't just talk about, well, the service is voluntary or it's not, but also add on to that the importance of why that particular support is present. So the reality is you have voluntary, but you also have a much broader conversation with the youth or the parent about the benefits of the service. The second piece, I think, is, again, it's very well informed about our system. We want to ensure that if Mike is working with a family, he's aware of previous supports that family has that access to. So we're not just trying the same thing over and over again, which is exactly one of the points a particular family member made during the week, that the service array needs to be broad and have more unique services depending on the specialized, I would say, needs of the family or the youth. And we can't get in a position of trying to fit the family into the service that we have available. We have to have a broad array given the unique needs that we know are out there. So points well taken. I'm trying to think in the chat. Thank you, Joanna, for putting the link to the website in the chat. Yes, we will certainly be sharing these slides, and we are taping this today, so we can flip this back to the group, both with the slides and the link, and you can certainly feel free to share this broadly.
Yep, absolutely.
Yeah. Any other questions? I don't see any hands raised.
No, is there anything in the chat? You just checked, right?
You know, I just took a quick look, and I think that, yeah, Sarah, I think your point is well taken. I think Sammy's suggesting that the providers and parents talk together and decide on how that message could be brought to the youth, and it relates to your first question. Joshonda handled a couple regarding QRTPs. You know, again, I think the takeaways from this morning for everybody is we are very proud as a state about our collaboration and the transparency. Every document, everything that we have said in our meetings, any PowerPoints we've used, videos, are all on our website. The work is not going to end in April, or now it looks like it's pushing to May. That's what we call the first finish line. This is going to be an ongoing process where we want to include as many voices as are willing to, in fact, come to the table. Changes are going to be made, systems are going to evolve, but it is really seizing the opportunity to ask all of ourselves, what are our values? What do we want the experience to be for the children and families in the state of Connecticut to access and receive supports? And then aligning our resources, in fact, to those values. And we're very appreciative of the Statewide Advisory Council for hosting us today. I think it was a great suggestion, Sarah and Mike.
Yeah, yeah.
So Joshonda, any closing thoughts? Other than that, I think we can probably end up.
We can. Thank you all so much for your attentiveness, and we appreciate the comments in the chat, and we look forward to working with you going forward.
You bet.
Thank you. Thank you for your time.
You got it. Thank you, everybody. Have a great day.
You too. Thanks.
Thank you for the invitation.